So I'll just get going here. So I'm Sam. I'm the Regional Bloodborne Pathogens Navigator for Northern Health. The presentation I'm giving today is focused mostly on just the indicators reporting. And I'll just talk a little bit about how the clinic I used to work at adapted it. So in the fall of 2009, I was an RN at Central Interior Native Health, and it's also when the collaborative started to launch. So Northern Health put together one large team. The team consisted of staff from Native Health, staff from Northern Health, staff from PLN in Prince George, and also staff from Smithers, and Darren from Vancouver from PAN. So we all came together. There was probably about, it seemed at times, 15 of us in the room, and we spent a lot of time just learning how to communicate and how to get everyone talking the same language, coming from 4 different organizations in a large geographical area. So largely what had happened is we decided to kind of split the load a little bit. So Northern Health took over the qualitative reporting, and Native Health accepted the role of reporting all of the data, so the numbers. That task fell to me, and to be straight up honest, when it fell on my desk, I was not too happy about it. It looked like a very onerous task, and I remember thinking my time could be better spent actually providing care than trying to figure out this really intimidating looking spreadsheet. A little background about Native Health. At that time, we had about 1,200 clients registered. About 5% of those clients are HIV positive. I think back in the day there, we had probably about 50 clients registered that were living with HIV, and now we have right around the 70 number. And I was the HIV-focused nurse, so it was essentially my role. So first thing, if you can see those numbers, this is the report that was asked to be produced. So there's, I believe, 7 indicators. And I remember we had an EMR, and I thought it was going to be okay to do it, but I still didn't really want to do it because I didn't quite realize the value that this was going to offer us. And I think the first month, it took me probably half a day to figure it out, and I was getting like 110% and like minus 85%, and nothing was working. The second month, it probably got maybe a little in closer. And then probably like by the 5th or 6th month, I actually realized and figured out how to make this report work for us. And it also got down to the fact that it only took about an hour. Luckily, Native Health had an EMR, which was quite easy to produce a lot of numbers. I know a lot of the other teams struggled a bit if it was paper-based. So as we grew with this report, we were really able to actually gauge of where we were at. And so this is a report that we produce monthly. And I was able to see our progress, and it actually became one of the most valuable tools we had for the collaborative, from my opinion, because it really allowed me to look and see, okay, where do I need to focus on? If we look down, say, in August of 2013, the last time I produced this report, I've been in a different position since then, only 77% of our clients, I believe, have had a viral load test done in the last 4 months. So the new staff coming on, the new coordinator, Janet, I know worked her butt off over the last month to get that number up. Right, Janet? There we go. All right. So she's working on those numbers. I haven't actually, so this was Janet's first time of producing the report. So I was just looking at it on my phone, and it's amazing. She's got a couple 110% in there, and she's got some minus 85%. And so it was quite entertaining. So I'm probably going to have to go sit with her and help her figure it out again. But it actually became a really good, useful tool that we could actually gauge where we were and where we wanted to put some initiative each month. And then it also allowed us to track the long-term, the trends, if it was just a blip, a one-off, or where we were going. So it really helped guide practice. It also really helped to just organize the clients living with HIV and move forward. Also, at that same time when the collaborative came in, what we realized is that we could definitely get people on treatment, and we had people on treatment, but we were struggling keeping people adherent and keeping people successful in the treatment. So one of the programs that came out of the STOP HIV collaborative was the Medication Adherence Support Program run out of Native Health in cooperation with PLN and Northern Health. And so in designing that program, we actually got to take a lot of the indicators straight from the collaborative, tweak them a little bit, and put them into the indicators for the adherence program. And one of them would be that we have a pharmacy indicator. So we want to know how many of the clients have had a pharmacy visit within the last month, 4 months, and within the last year. Other things, we also, on the adherence program, we looked at housing. So every time this report was produced, we could tell if clients were stably housed or unstably housed. So that's essentially it. Right there, I'm just going to say thank you. The end message is here is that Yes, this report really looked intimidating, and honestly, the first several months it was, but as we grew to adapt it and integrate it into our clinic, it absolutely assisted us in kind of achieving or striving to achieve the benchmarks that was set by the collaborative. Thank you.